The National MS Society has come out with several different recommendations and guidelines that relate to the ongoing care, the multidisciplinary approach to caring for multiple sclerosis and its multiple symptoms. And of course, when one thinks of therapies for multiple sclerosis, there are those that are designed to treat acute relapses. There are multiple treatments that are designed to try to change the course of multiple sclerosis by limiting new disease activity and injury. And then there are multiple treatments designed to treat symptoms of multiple sclerosis that include fatigue, include sleep abnormalities, include issues with pain, discomfort, tingling sensations, as well as issues with instability of gait and a variety of other features that are commonly experienced by people living with MS. Physical therapy in multiple sclerosis has been studied over the years. Patients often feel more actively and proactively involved in their care when they're participating in physical therapy. Experienced physical therapists can also provide input into exercise regimens, which can be very important. And of course, people who have more advanced disabilities, the passive physiotherapy can also be important to limit contractures and to ensure that people are not going to be subject to some of the complications of substantial disability and immobility. Among common symptoms of multiple sclerosis are fatigue and spasticity, both of which can be very debilitating for patients. There are different approaches to trying to deal with each of them. There are some medications that are out there, although imperfect, and lifestyle and activity can also be very helpful. For sleep in particular, sleep hygiene is very important to understand. It may contribute to daytime sleepiness, and we know that sleep is disrupted in individuals with MS well above the average in the population. The depression is a common feature also in multiple sclerosis, more commonly present in MS than in the general population, and of course can feed into people's level of motivation and ability to engage. So is another important aspect to consider when someone is tired. One has to consider medical conditions such as low thyroid levels or anemia as well, so medical conditions that can contribute to fatigue. So overall, a multifaceted contribution often to the patient's experience. Spasticity is a potentially very troubling symptom, can be particularly aggravating at night, can be associated with spasms that can also awaken significant others and can create issues with sleep quality and hygiene, again, in turn contributing to daytime fatigue and sleepiness. And in addition to medications that can be useful for spasticity, having an exercise regimen, including both passive and active stretching, can be quite helpful. People with MS can experience bladder problems, which include commonly increased frequency of urination and what's called bladder spasticity, where they get a sudden urge to urinate and they need to urgently go, otherwise they may lose control. The approach of not drinking as much is not a particularly advocated approach. One should be able to maintain good hydration, but there are ways of trying to address issues of bladder problems, including the urgency and the spastic bladder, and these include a number of fairly straightforward medications which can be quite effective at limiting these symptoms.
Acute exacerbations are important in the short term because people function less well in so many instances, and also in the long term because recovery is unpredictable and may be prolonged, and a number of relapses, either clinical or subclinical, increase the likelihood that there will be progressive disability over time. We have a number of options for treating them. The classical treatment is steroids, IV or PO, intravenously or by mouth, in relatively high doses. One may alternatively use a lesser consideration of ACTH, or when the relapse is particularly severe and particularly worrisome, plasmapheresis.